Hello friends, welcome back to my channel. This video is again continuation of the videos regarding MRCP UK exam preparation. This is kind of a last video for that. We are going to talk about PACES exam preparation in this video. So PACES exam, the full form is Practical Assessment of Clinical Examination Skills. It is a final and rigorous practical assessment of a candidate. To take this exam, you must have passed the part 1 written exam. So you don't need part 2 to take PACES. You can directly take PACES after part 1 exam. This exam is very important because after this exam, you can enter higher specialist training called ST3 training in UK healthcare system or NHS. That's the reason this exam sets rigorous standards to ensure your competency across 7 core clinical skills, which we'll be discussing later in this video. What is the format of this exam? So it lasts for 125 minutes and it takes place in a clinical setting, either a hospital or a clinical skills center. That's very obvious because it is a practical exam. There will be 5 clinical stations where there are either patients or surrogates. At each station, there are 2 independent examiners who will observe and evaluate the candidate's performance. So remember, there are 2 independent examiners who will be scoring you. These are the 7 core clinical skills. First is physical examination. So they will look at your examination technique and skills, and they are very particular about specific examination techniques and the order to follow, so that it becomes easier for you to identify physical signs. So they have already decided kind of a protocol for this examination, how you will examine, and so that you have to learn and also identify physical signs after this examination. Then third skill is clinical communication, how you communicate with the patient. Fourth is differential diagnosis, how do you construct it. Fifth is your clinical judgment will be tested. Sixth and seventh skills are very important because this is about how you maintain patient welfare, how you touch the patient, how you address the patient, how you undress the patient. So your kind of interaction with the patient will be observed closely, and how you maintain patient's welfare during the whole exam. And last but not the least, managing patient concerns. No patient or surrogate should leave from your examination without their concerns being managed. Remember, managing patients' concern is the most important part of this exam. Now, to pass this exam, again, remember, you have to pass all these 7 skills. So you will understand this when I'll show you how they evaluate and how your result will look like after this exam. And so remember, this exam is different from part 1 and part 2 exam, where they not only test your clinical knowledge but also your clinical skills and how you behave with patients. There are 5 clinical stations in this exam. As you can see, there is a 5-minute interval between all these stations. Okay, so station 1 is divided into 2 parts: communication and respiratory system examination. Station 2 is consultation. Station 3 is again divided into 2 parts, which has 2 different systemic examination. One is cardiovascular and another is neurology. Fourth clinical station is again divided into 2 parts: abdominal examination and communication. And last is consultation, which is for 20 minutes. So total there are 2 consultation stations for 20 minutes, 2 communication stations for 10 minutes each, and there are 4 different system examinations stations. Clinical exam, station 1, 3 and 4, this are known as the physical examination encounters. They want you to demonstrate a comprehensive and correct physical examination technique. They want you to not just examine but also detect the physical signs from that examination, construct a differential diagnosis, suggest a sensible and appropriate treatment and investigation plans. And last but not the least, they want you to treat a patient with dignity and respect. This stays same for all the stations. The last point is very important. Before seeing each case, you will receive written instruction as to what is required. 10 minutes are spent with each patient. For each case, out of that 10 minutes, 6 minutes are allowed for the examination, 4 minutes will be questioning from the examiner. you will be expected to differentiate normal from abnormal findings. So before your exam, your independent examiners examine the patient and they find out what are normal findings and what are abnormal physical signs, and they want you to exactly identify those signs. They Because they will be doing the same examination technique and finding out those signs, and they expect you to do the same. Station 1 and 4 are communication encounters. They want you to guide and organize the interview with the subject, either it is a patient or a relative or a surrogate. You have to explain clinical information, apply clinical knowledge, especially knowledge of ethics. This is something you have to learn, because this is very specific to UK healthcare system and NHS and their laws. So this again, communication encounters are not only about clinical knowledge and clinical skills. It is also about how are you managing the emotional part of the patient. So emotional support has to be provided, empathy has to be always there in all the encounters. And last but not the least, treat the patient with dignity and respect. This station features written instructions for the cases are given to the candidate during the 5-minute interval before this station. 10 minutes are allowed for the patient interaction, and there will be no examiner candidate interaction. There will be no viva, there will be no questioning. They'll just mark you on the basis of observation alone, how you are speaking with the patient, how you are showing emotional support, and how you are showing your empathy. Station 2 and 5 are consultation station. This station is, creates a situation similar to what you find in your clinics and OPDs. So here, for each case, there will be 20 minutes given, where you are taking a detailed history, you are carrying out a relevant physical examination, and also managing patients' concerns. So as you can see, I have highlighted the word concerns, because this is something you should not forget when you are in this consultation clinical station. Okay. Again, the written instructions will be given between in a 5-minute interval before this station. Out of this 20 minutes, 15 minutes will be allowed for history taking, examination, and discussion with the patient, followed by 5-minute question and answer with an examiner. So because they believe that in a clinic 15 minutes is enough for you to take a history, like relevant history, and examine the patient. So this is how they have designed this station. Now this is a very important picture here. This is how your result will look like. So as you can see, the result is not based on whether you have successfully passed all the clinical stations. They are not looking for that. They are actually marking you on this 7 core clinical skills which we discussed previously. So your marking system will be according to those 7 core clinical skills. So for example, out of 5 stations, you do not pass 1 station, then that doesn't mean that you have failed the exam. But out of this 7 core skills, if you do not pass in any one of the skills, that means you have not passed the exam. So passing the clinical stations is not important, but passing the 7 core clinical skills are important. So that's why they say that if one of your stations, if you feel have not, you have not done your best in that station, do not take it forward into your next station or other stations, because you can still pass this exam even if you make a mistake in your one of your clinical stations. So as you can see, the scoring, so for physical examination, out of 24 they'll score you, identifying clinical signs out of 24, then clinical communication is 16. So what I want you to focus here is, as you can see, that in physical examination your total score is 24, out of which you need 16 to pass. So there's a large window here, you have 8 marks of window there. Then in identifying physical signs, you have 10 marks window. So your total is 24 and you need only 14 to pass. Clinical communication, it is 5 marks, 16 and 11, right? Differential diagnosis, again 9 marks. So total is 24, you only need 15 marks. Clinical judgment, again you have 12 marks of difference. So 32 is total available, you only need 20 to pass. But as you can see in managing patients' concerns, from 16 you need to pass at least 10. So patient's concern, there is a smaller window, right? And in clinical communication also there is a smaller window. So as you can see, these two clinical skills are very, very important. And it is said that in managing patients' concerns, if you forget even in one station, there is a chance that you might not pass. In managing patient welfare, you have total score of 32 and you need 28. So as you can see, the communication part and the concerns part and the welfare part, the windows are smaller. Okay, so you need to make sure that when you are practicing for this exam, you need to make sure that these three skills especially you are maintaining in all the stations. This is how your exam result will look like in the end. Now, final thing is, how did I prepare for it? So my experience regarding it. So there are videos of the examination, of the communication and of the consultation on PACES, and I bought it. That is the only way you can actually learn those skills. Practice, practice and practice. You have to practice in a way where you should be doing all the steps of examination, or where you should be asking patients concerns subconsciously. Like you won't have time in your exam to remember all those skills. So you have to practice as such that you are subconsciously and doing it in your exam. So they also say that if you're practicing somewhere in a hospital, keep doing the same physical examination, keep talking with the patient in the same way as you're going to talk with the patient in the exam. I took classes, a lot of classes I took. There were two personal classes. They were expensive, but it was very important because this exam is very different from what I have experienced, and different from all the examinations that I have taken before. So in personal classes, they have around 3 to 4 days of classes, and they teach you all the clinical stations, and all how again physical examination skills, and you are doing it on the patient. So while seeing the videos, you will be seeing other person doing it, but when you take personal classes, you will be doing the examination yourself under the supervision of someone who's already passed this exam. So they'll tell you where you are doing something wrong. And I took two online classes. So in online classes, again, what helps is your physical examination, sorry, detailed history taking, right? So on clinical online, you can they'll teach you how to take detailed history, and how to communicate with the patient, so show the empathy and all these things. So I took this 4 classes before I took this exam. Know your weaknesses. You have to find out what you are doing wrong, and which specific areas you are doing it wrong, and you have to make it strong again by practicing. And more mistakes you make in your practice, more things you will know that this is something that I have to learn more, and that will help in your examination. So, and do not forget concerns. So in 15 minutes consultation, if you are still taking physical examination, forget everything. In last 2 minutes you have to ask concerns, and they will tell you when the last 2 minutes are left with the patient. So concerns have to be asked. So I hope this video was helpful. Remember, this exam is not an easy one. A lot of times people do not pass it in the first try, and fortunately I did succeed on in the first try. But many candidates, they have to give this exam at least twice to succeed in this exam. So practice, practice and practice, not only on your patients, but you can also practice on your family, friends or colleagues. Do not be shy about how you speak with empathy and how you communicate with the patient. Learn it, kind of blend it in your regular practice, and you will be able to crack this exam. So all the best for your exam, and I hope this video was useful for you. And obviously subscribe to my channel and like this video. Thank you so much.